Representative Megan Egbert, how are you?
I'm doing well. How are you?
I'm doing swimmingly. I'm pumped to talk to you. You're a freshman representative. You did get appointed last year, after
Correct.
the death of one of the representatives, and then you ran and you were elected.
Yes.
Fantastic.
Thank you.
You are a former librarian. You are a law student about to graduate. That's going to be fantastic for you. You're also on health and welfare and a number of other things. We were just talking and I wanted to get the cameras rolling. Explain the situation in Salmon, Idaho. And Salmon is an example that people bring up about a lot of things. Like Representative Birch was in here the other day and Steve was saying, hey, there's a school. He was saying Chalice or Salmon, but it actually turns out it's Salmon. He's like, there's a middle school on one side. I was going to do his accent. I can't do his accent. But in essence, there's a middle school on one side of a state highway. That's a brick and mortar middle school. And then across the highway is the elementary school, but it has portables. They don't have a gigantic tax base. And so for years, the kids in the portables that were in elementary school, so we're like talking 5 to 11-year-olds,
Yeah.
had to cross the street to go to the bathroom in the brick and mortar school. So in like an Idaho winter, these kids are putting on their coats and going to the potty across the state highway and then back to their portables. So Salmon is one of those things where it's like, there are a lot of aspects of Idaho that, it appears that Salmon is kind of being like forgotten or left behind. And you were bringing up one with regard to healthcare. So again, please explain the situation there.
Yeah. And I love the whole Salmon connection because I was on the other end of that when Chris Mathias was talking to Monica Church, Representative Church, and was talking about salmon. And I was like, are we talking about fish or the place? Because he was asking her, like, do you want to go talk about salmon?
Right.
And then everybody's like, wait, we have to clarify. Like, there's actually stuff going on with both those things. So,
Yeah. The fish,
yeah.
that's a hot damn mess.
I know, right? But
Yeah.
anyways, the story that I was sharing, because I'm on health and welfare, so it's kind of top of mind right now.
Sure.
I was at an event recently with a bunch of physicians. I was sitting next to an ER doctor. We were talking about the physicians shortage, specifically about OBGYNs in Idaho, what has happened as a result of some of the legislation that we've passed. And he turned to me and he said, I just need to tell you something, like I need you to know this. And I said, okay, like I'm brand new. You can tell me anything. I probably won't be able to do much about it. And he said, I need to tell you about Salmon, Idaho and the hospital there. And he had some expertise. He'd been there before. And he said they have an OBGYN who's been there for quite some time. And he's the only one for a long ways. I don't remember the exact
Like miles
number.
and miles
Yes,
and miles.
miles and miles and miles. And he said, sometimes he does go on vacation and they plan around that and they make it work, but he's getting ready to retire. And he said, nobody's going to come here, just so you know. We cannot recruit any OBGYNs right now. He said, and especially not to somewhere that remote. And he said, what I need you to know is that ER doctors, because people keep saying, well, they have an ER there, right? And I've heard this about up north as well, Sandpoint area, there's an emergency room available. And he said, ER doctors cannot perform cesarean sections unless the patient is dead. And I just sat there for a second and was like, wait. And he said, so if there's been a horrible accident and the mother has passed away, we can perform a cesarean section to save the child's life. So, we know a little bit about it, but just for that instance, we are not allowed to, in any other circumstance, to perform a cesarean section.
So essentially, in effect, it's saying, hey, look, if this OBGYN goes on vacation, yeah, they might bring in another OB. And when that guy retires, they're not going to have anyone. The retort that most people have is, okay, but if you don't have an OBGYN, it's okay. You still have an emergency room. Emergency rooms are capable of doing surgery and things of that nature. So they can deliver and deal with traumatic things.
Right.
But the reality is that they are limited in scope based on like insurance and certification. So it's like, yeah, I can do. So like, say you're in the middle of a delivery and things go south. Like I have a family member who was delivering a child and she was in labor. She's a pretty petite gal and was in labor for like 24 hours. And they realized like, this kid needs to be out right now, like 10 minutes ago. And boom, it was like a 60-second cesarean, the kid's, crying, the whole thing. And the reality of that is that like when you make that call, that happens immediately. Yeah. And it's, especially if you have somebody trying to do like a normal birth. And so the bottom line is in this situation is like, no. Just because we have an operating room, just because we have an ER crew does not mean we even have the certification to do a cesarean. We can only do that in the absence of life of the mother with still existing, baby to be delivered.
Correct. And I'm so, new to this, and this is not my specialty at all. And so I said to him, oh, so you're talking about like you would have to life flight a mom out of salmon if she needed a C-section. And he's just looking at me. He said, no, I'm talking about the mom would die if she needs a C-section because nobody could do it. And I have to tell you, that was the moment that I decided I could not be on health and welfare this year.
Aren't you on health and welfare?
I sure am. But I was like, we are talking about people's lives.
Oh my God. Can you do me a favor? Can you rotate this mic up up the other way. There you go. There, and pull it forward just slightly. The people want to hear from you,
Sure. Like that.
Perfect.
Okay.
Yeah, health and welfare. It's one of those things that in this state has really, I had Representative Vanderwoude in, and he was fantastic. And we talked so much about, not as much as I would have liked, but so much about, we touched on women's reproductive care is complex.
Yeah.
And whenever you say women's reproductive care, people instantaneously go to like, oh, you want to kill babies. It's like, okay, or we want babies to survive. Like one of the two, right? It's like, the whatever.
Yeah.
In cases of L&D, we live in a very rural state or a state that has a lot of rural areas. And that's hugely problematic for a number of reasons. Like we don't have high wages. We don't even have OBGYN residency programs in the state of Idaho. So imagine you're born and raised in Idaho. You go to college in Idaho. You go to med school in Idaho and you're like, I want to deliver babies. I want to be an OBGYN. Awesome. They're like, great, go away somewhere else for a while.
Yeah.
You go away somewhere else and then you have to, and now mind you, as you're graduating from residency and stuff, like you have to intentionally come back and you're being headhunted by everyone. And you're like, all right, so I'm going to go to like Salmon, Idaho and be broke because they're not going to pay me that much money and have to I'm probably not going to be able to deliver. This is another thing that I found out. Brad Turpin, who's the CEO of the Emmett Hospital, they had to close down their L&D. And I originally got a hold of him because I thought there was the legislation that got passed a couple years ago was really the problem or a big part of the problem. And he told me right away, he's like, listen, man, it's like, maybe it's a problem, but it's not as big a problem as you think. And I was like, oh, fantastic. Like, these are the things I want to know. He explained, he said, look, if you're going to law school, but say you were going to med school and you're like, all I want to do is deliver babies. I love bringing people into the world. God bless you, woman.
Yeah.
Like, awesome. Not what you do, but you can imagine.
Sure.
He was like, if you want to deliver babies all day, you're going to go to a place that's delivering babies all day. And that's not going to be a rural hospital.
Sure.
And I was like, oh, he said they have horrendous problems getting labor and delivery nurses and nurses in general. He's like, if you are an L&D nurse and that's all you want to do is support and delivering life, yeah, you'll get some of it in Emmett, but you're also going to have to wear a lot of different hats because nobody gets to be picky in a rural hospital. Like you got to do anything you can or anything that needs to be done within the hospital. And just that perspective of like, okay, if I just want to deliver babies, yeah, I'm not going to, somewhere that only delivers once a week. And then the rest of the time I have to do this other stuff. Like these are real problems that health and welfare is going to have to solve.
Absolutely. And I think another layer to that is just our limited opportunity for residencies. That's something that we've heard a lot about too, because when you go somewhere to do a residency, I think there's an increased chance then that you love the area, especially if it's Idaho, right? Yeah. Fall in love with the area and then want to stay there. And we have such limited opportunities for those that we're also not getting that pipeline.
Right. So people have to intentionally move here, which means they have to be enticed to move here and it's not going to be for the pay.
Exactly.
So what do? Let's solve this right now, Representative Egbert.
Let's do it, right?
Let's do it.
I would say we start with, and I understand that the laws aren't all of it, but at this point, Idaho has a reputation that's going to take years to correct. And I do think that OBGYNs specifically are afraid to practice here. That is something that I've heard. People aren't like, let's move to Idaho,
To practice.
where I could face,
Right.
legal challenges if I can't decide whether this is a risk to health or a risk to life in terms of a pregnancy complication, right? So I think that's one of the things that we have to do. I think we do have to expand residencies, especially around OBGYN and those, type of, I think we have very limited ones right now. We do have a family residency, I believe. But I think that there's a lot of room for growth there as well. And then, we got to do something about the wages in the pipeline so that we actually have people wanting to practice in Idaho. It has to be appealing to them. I'm of the age where I'm done having kids, but my parents are getting older, and I grew up in North Idaho, but I've lived in Boise for a long time, and they live here now. And I always felt some security in that in terms of their healthcare as they get older, that like we're in the place where I can find specialists for whatever I need. And that's not the case anymore, even for the type of specialists that some of our elder population needs, because maybe they're married to an OBGYN and they are out of here. Or maybe, we also had last year what they call the Band-Aid bill, which is not a doctor-friendly piece of legislation
What's
either.
the Band-Aid bill?
So the Band-Aid bill was a parental consent bill. That I think had, good intentions, but sometimes some drafting challenges can lead to maybe bad practices. And so some of the stories that we heard from physicians was that they're not allowed to, specifically for minors, they're not allowed to provide care for minors unless it's an emergency situation. But
In the absence of parental consent.
Correct. But one of the interesting things is that, like, for example, pain is not considered an emergency. And so, like, we heard a story that has haunted me in North Idaho about a high school student who traveled to North Idaho for a sports tournament, traveled with their coach, but their parents were out of the country, broke their femur, and had to wait in the emergency room for like 6 hours, and they couldn't even give him Tylenol because pain is not an emergency. So
Oh my God.
I know.
Is this guy from Boise?
I don't know where.
We got to find this kid.
I know.
Get him and his crutches in here. I want to hear this. And this is particularly difficult. I mean, in the world where we're trying to, like a lot of this is tied together. So we have women's reproductive care. So presumably we are delivering more babies, and perhaps to people that don't feel that they can necessarily take care of them. And okay, understand, like there are problems all around everything, no matter where we go. Yeah. And because of that, we are obviously making an investment. I've had Alex Adams in several times talking about the foster care program and how we're trying to improve foster care system, have more people in have fewer people in foster care, but have more potential foster families. And these are examples of like perfect example of like, look, we have an emergency, or your foster parent, you get this kid, the kid has been neglected, parents got taken away from the parents. Yeah. You just take them to get to a physician, to a pediatrician, to just get a normal checkup, or they're in pain, or you got to take them to see a dentist. They haven't seen a dentist ever or something. I don't know, whatever it is. But you have these situations where you have well-intentioned adults trying to take care of minors, and the parents are either unreachable, they're in jail, they're somewhere, right? And because you're a foster parent, you don't have, like you're not the legal guardian yet. You're just like a foster parent. Yeah. Man, what a train wreck.
Yeah. So I think there's a lot of things we can do. And I think, health and welfare is an interesting place to be on this year, as well as, again, we're talking about the possible repeal of Medicaid expansion. And I do think that this is another topic that If you ask providers in Idaho, they're very, very nervous about, right, of what would happen if we did repeal Medicaid expansion, how many people would lose care, what that would mean for our financial situation. I think there's a lot of concerns around that.
I had Luke Mayville in here yesterday,
Yeah.
and he has spearheaded citizens 3 large citizen initiatives. The Medicaid expansion was one of them that was successful. Then there was a school funding bill that he was successful in bringing it essentially to market, and they didn't make it to a vote, didn't go to term because the legislature and governor actually passed something to improve funding. So the value of that got axed. And then obviously we saw Prop 1.
Yeah.
And in Prop 1 and Medicaid, both of these examples, they made it to term, and the populace overwhelmingly decided one way or another. For Medicaid, it was positive. For Prop 1, it was negative. Okay, great. So like this initiative system is working. But it's interesting to me. I don't know a lot about the initiative process until, like the last 24 hours. And it is really clear that this has been roundly utilized in Idaho. For instance, property tax relief, that's a big one. We also passed through an initiative process term limits for our legislature, which got overturned, which is wild.
Sunshine Law, right?
Right, the Sunshine Law. So we only have that Sunshine website and the Sunshine Law because citizens came forward and said, hey, how much money and who gave it to you? And you got to make that public. Like that didn't exist in Idaho. And that's really cool. I think that's really interesting that we have this thing. But again, when we're talking about Medicaid, it's like the people wanted this and it is on the chopping block. I don't know the ins and the outs of funding. And I know Representative Vanderwoude did say it has ballooned in cost. 90% of that cost naturally comes from the federal government, but Idaho still has to pick up, I think the initial estimate was $40 million and now we're up to $100 million. It's like, okay, so it costs, 250% of what you thought it was going to cost. Okay. Is there value that's commensurate with that 250% increase? Like, are we getting more value? Are we getting less value? Did it just increase in cost without any increased benefit? Like what has caused that?
Correct. And I think it's also important to note that we still paid for this before, just from a different budget, right? I mean, people need health care. Like that doesn't go away. And just because whether it's covered by Medicaid or not, really the only thing that differs with that is how much the federal government is going to pick up of that cost. Because before we expanded Medicaid, it would fall on counties, right? It would fall on hospitals. And so it
would fall on doctors. Doctors would have to.
And we had a fund with the state of Idaho as well for indigent care. This catastrophic, I don't remember the actual name of it, but we were paying for it. That's the point, right? Like there's no way to get around that people are going to need medical care.
Right. And the emphasis of, I remember years ago, somebody was telling me, they're like, listen, we've always had socialized medicine.
Yeah.
You just don't know it. Yeah. Right. And you're pointing out things. And my dad's a physician and I was actually born when he was in medical school. And it's really interesting because I grew up when he was going through like residency and internships and, the whole thing. So, grinding through with 4 kids, it was a difficult pull. But the point is, I remember him, like leaving it in the middle of the night to go places. And I remember hearing him talk about it later that he knew he would be going some to a poor area in our community. And he's like, I'm not getting paid for this tonight. Like I can tell. Yeah. And there were real problems. So it was like, we were funding it, but it was like, my dad was paying for it and you were paying for it with your property taxes. Exactly. And then, with our income tax to the federal government, they were kicking back to the hospitals, covering gaps. So everybody was chipping in, but it was a forced chip in. It wasn't something like, anyway.
Absolutely. There's, because we're talking about health and welfare and you brought up Director Adams. And I think, we're really lucky to have somebody who has these really concrete goals and has this history of being really, efficient with things. And you always, call yourself an idiot, which you're not. And I always say,
that's what you think.
No, you're not. But I always say, I'm just a mom. Like, I'm just a mom, like sitting here. But But one thing
You're a law student. I marginally have a bachelor's degree in rhetoric. Like, that's not even like, what you going to do with the like, what do you want to be when you grow up, Johnny? A fireman. Oh, what do you want to be, Sue? A rhetoric degree. Like, it's so ridiculous. Like, what a joke. Like, I am just a homeless guy who's made it a long way.
Well, you're doing pretty well.
Oh my God.
But one of the things that really stuck with me, I started an MPA program. I didn't finish it. But
what's an MPA program?
So Masters of Public Administration.
Oh.
So learning about this crazy, government stuff. But one thing that stuck with me was this example that a professor gave. And he said, you can't let efficiency be the enemy of effectiveness. And that has really stuck with me. And this was the example that he gave. For example, if you're designing a city, like the most efficient thing to do when it comes to providing mail service would be to put like mailboxes in the middle of the city, and everybody has to go to those mailboxes, right? And if you think about it, like, yes, because then the mail delivery person just has to go to one place.
But that's only efficient for one person. That's inefficient for everyone in the. That sounds like you want to talk about horrible traffic. Everybody going to a centralized point. Like, efficient would be like 4 mailboxes on the 4 borders of the city. Like, that would be far, because at least you split up the traffic pattern and make everybody go in a big circle. No, just have them drive through and throw the mail into their windows. Right. That's what you do.
But that's because it's not effective, right? So it wouldn't be effective to do that, as you mentioned, because everybody would be driving into the city at the same time. So it doesn't make any sense. Sometimes when I hear these really complex topics in health and welfare, I want to shout, like, we're putting the mailboxes in the middle of the city, right? And so last week, there was an article that came out that the DOJ has notified the state of Idaho that we are not compliant with the American with Disabilities Act because how we're treating our adult population with disabilities, right? Because we're putting them in congregate care facilities when there's a less restrictive alternative of them being out in the community. Now, it's complicated, right? The reason that we're putting them...
This is the Department of Justice?
Yeah. Yeah.
And they notified, like,
the state of Idaho,
Labrador?
Yeah, that we are not compliant with the American with Disabilities Act.
Okay, I'm sorry, keep going. So that we're putting them in congregate care instead of putting them...
in the community with services. And they don't want to be in congregate care. Something like 68% of them that are there don't want to be there. But the problem is we don't have the direct care workers right now to care for them in the community because our Medicaid reimbursement rate is so low for those providers that nobody's going to do it, right? Like, they're making like $14-ish an hour or something. And what are the alternatives you could be doing?
I mean, In-N-Out pays 20, I think.
Yeah,
I had the dairyman guy in here. He says they start at 18 to 20.
Mm-hmm. So it's complicated, but sometimes I think that we can get so laser focused in on this efficiency thing. What's the most efficient thing we could do as a government that we lose sight of the effectiveness of it. And that's just one of the many examples.
Okay, can we come back to the community? So essentially, we have congregate care, which costs an astronomical amount of money.
Yeah.
Right. That's one thing that Director Alex Allen brought up from health and welfare is like, listen, if we go, from a kid being with his parents to a kid being in foster care to a kid being congregate care, the cost is astronomical. He's like, we would be far better off 1,000 times over trying to help that kid successfully and help that family function successfully instead of like pulling the kid out. Once you pull the kid out, it's like 20 to 300 or $20 a day or $40 a day or something like that.
Correct.
And that's in foster care.
Yeah.
Once you go to congregate care, it's $300 to $1,400 a day.
Yeah.
So because we don't have workers, we're footing the bill for like an astronomical cost of congregate care, but there's no way to get the workers because ain't nobody working for $14 an hour to pick up grandpa, like wipe his butt, take care of him and all of those things.
Yeah, exactly.
Oh my gosh.
I know.
And I assume this is for the population that doesn't have family members with means or like has substantial disabilities and can't take care for themselves.
Correct.
How do they, like, where did these people come from? And that, like, what were they doing? Like, let's say somebody's 70. What was that same person doing at 50? Like, where were they? Is it somebody that essentially got like disabled on the job, or is it somebody that who's always been in some kind of assisted care? Or?
Yeah, I think it's hard to say, and it's probably a diverse array of all of that. But yeah, and I would say maybe they do have family members who care for them. It could be that they need care all the time, though, right? And so then you're in the very difficult situation of, do I work to make money to pay for a caregiver, or am I just the caregiver all the time? You know, one of the other things that we've heard a lot about is during the pandemic, Idaho had a specific Medicaid waiver that allowed family members to get a small amount of compensation for being a caregiver for their family member, for their child with a significant disability. And you can see where this is kind of like two birds, one stone type situation, because they're on Medicaid. They need somebody to care for them anyway. It's a lot easier if it's a family member who already knows them and their condition. And also, you know, some of these situations are very sensitive in nature. We're talking about teenagers who might need diaper changes, right? And as a parent, like, that just kills you to think about having to hire somebody to do that and the vulnerable situation that your kid is then in. So we allowed this waiver, which I think helped a lot, specifically because of the direct care lack of people we have right now. And then unfortunately, they found that some people were abusing the system. And so they ended this program prematurely. And so a lot of people are really hurting right now. And we're getting back to this situation where we're looking for workers that don't exist, you know, to do the work. And, you know, I believe the department's doing everything they can, but I just always want to know, like, what is the scope? And it's not just in health and welfare, everywhere in government right now. Like, what is the scope of the problem? And then what has been our response to it? And like the ramifications of that response, right? Like, is this two people out of how many, you know, that might have taken advantage of this system, or is this like a pervasive problem? But, you know, one of the alternatives I think that they're offering to people, these families who were getting a small amount of compensation to take care of their child and be their caregiver because they couldn't hire anybody else, is they suggested that they go be a direct caregiver for another child with developmental disabilities. And I don't mean to laugh, because there's nothing funny about that, but it just doesn't make any sense, right? Like, we're putting the mailbox in the middle of the city. So it's,
I appreciate that analogy. I hate the centralized. I live in a spot that has like the centralized mailbox.
yeah, I did before too.
I hate it. It's just give me a stupid mailbox. Let me put a Snoopy sticker on it. Like, just let me have my little slice of the American dream. And that includes a little flag that goes up and down. Like, can we just work together on this?
Yeah.
Okay. So how do we solve these problems?
Well, you know,
like, first off, I'm sorry to interrupt.
Nope, please do.
With the wage problem, this is universally a problem across Idaho. And apparently the coffee industry has figured out a way around it, because people are like, well, you can't increase wages or it's going to cost more. Like, coffees cost so much here. I'm like, you're running hot water over some ground black stuff. Like, why?
Yeah.
And like 9 times out of 10, it's not even good.
Yeah.
But like, there are certain industries who've apparently are like immune from price gouging.
Yeah.
Like, why is it that we can't pay nurses, but we have a $4.50 large drip black coffee?
Yeah.
Which is the only thing I drink.
And this is where, like, I will just admit, like, I don't fully know. It's so complex. I'm trying to understand it. You know, I'm trying to, you know, and I do have a really good relationship with the department, and I, you know, respect everything they do. And I'm just trying to dig in a little bit more, because it seems like it's very nuanced. I think it has to do with the Medicaid reimbursement rate. So I think there's a lot of complexity to it, but I think that speaks to, I hear from a lot of people as a freshman legislator this year, like, what are your goals and what do you want to accomplish? And I truly, I once had a boss where I worked, a new boss who we were so excited to bring her in. The place desperately needed changes. She was kind of known as a change maker. And she came in, and for like a month straight, she said she was not going to make any changes. And she literally just like sat on the floor and like took notes and like watched everything that was happening. And at the time I was so annoyed because,
Like, do something of value.
And that's what I finally said to her. I was like, there are so many things that need to be changed here. And she was like, I know. That's what I'm trying to figure out, right? So I am very much trying to take that approach of like, I'm not trying to change anything. I'm just trying to figure it out. So there's so much there that I'm trying to just ask thoughtful questions and do as much digging as I can and really be a student of the legislature right now and try and figure it out. So that's where I'm at right now.
You pretty much just outlined my entire day, every day, every day for the last 2.5 years. Like, I don't have any solutions. I'm just trying to figure this out.
I know. It's hard though when people are like, what bills are you going to carry? And I'm like, I'm just hoping to not look like an idiot every day. So yeah.
I let go of that expectation a long time ago. You know what's so funny? People ask me, I have a lot of, not a lot of friends, but I have friends, and then people I do. I don't have a lot of friends. I'm not good at care. I don't have a high caring capacity for friends. It's just like, and I can't make friends for friends' sake.
Yeah.
It doesn't work with me. Like you were an athlete. I was an athlete. Yeah. I tried to be friends with a dude in college that wasn't on the rowing team. We played chess a couple times, and I was like, you're kind of weird.
Yeah.
I tried to date a non-athlete once. I was like, so what do you do? And she's like, well, like I go to class. I'm like, and then
like for the whole rest of the day.
I was like, wait, I was like, hey, do you want to get breakfast? And she's like, yeah, like I go around 11. I'm like, when do you get up? She's like, well, I don't know, like 10:45. And like, I had to get up at like 4:30, 5 a.m. and go like bleed it through my hands in a boat, like in the bay. Like it was terrible, right? I can't make friends just to have friends. So I don't have a large caring capacity. Like we have to be engaged in some particular endeavor. But people ask me at times, people I meet just randomly who like, I'm trying to hide and eat lunch. And they're like, hey, can I ask you? I'm like, yeah, whatever. They're like, what do you think about this? And they try to get my position or like my thoughts on something. And it's really easy for me to say, I don't know, because I genuinely have no idea what the right answer is. Like no one has a solution. Totally. And all of the solutions suck. Yeah. Like, it's like all of this sucks. These are all like, there's no perfect party. There's no perfect caucus. There's no perfect, it's like, come on. Oh, you know what I want to say sometimes? I want to be like, bro, did you just hear yourself speak? Did you just hear that? Come on. You don't really think that. And sometimes I do. They're like, I know it's not perfect. I'm like, I got you. Come on.
Yeah. Yeah. I would say like so far, the only thing that I'm good at in the legislature at all is pointing out problems, but like zero solutions. Right?
That's a personality type though. Have you ever heard of Working Genius?
No.
Oh my gosh. Really cool. So the table group, this guy, Patrick Lencioni, he's a business consultant, happened to be a client of mine. I worked with one of his sons for SAT prep. I had no idea he was like this big thing. Anyway, I move up here and he reaches out to me. He's like, hey, could you make me some content for this like business character assessment test? I'm like, I mean, I guess I don't know anything about your assessment. Turns out it's this, he broke, instead of like, character assessments where you're like an introvert or, whatever. He was like, all that's meaningless. Yeah. He was like, that's not functional at all. Sure. He was like, listen, you have people that are wonderers, inventors, discerners. Then you have galvanizers, tenacity, and there was enablers. Okay. Point is, the wanderers are people that like sit around and just like, I wonder why that's brown. Oh, yeah. Like they just wonder random. You're like, that has nothing to do with anything. But they're really good in a business standpoint because they can look at things from a direction that no one looks at them. They're like, what did he say? They're like, I don't know why it's brown. And they're like, let's figure this out. So you have those people, you have inventors who just come up with things all day long, every day. They can't stop themselves. The things don't even have to have value. They don't have to be more effective. They don't have to be more efficient, but like they're going to come up with things like 100 a day. And like, they might come up with one where people are like, wait, what does it do? Oh my God, that's great. And they're like, oh great, I'm making another one. Right. Then you have discerners, and discerners can't invent at all.
Yeah.
They have no creativity, but what they're really good at doing is finding problems with the inventors.
Interesting.
Right? Because the inventors are like, look at this. And people are like, dude, okay, nobody's going to use that. Like, we have this. It's like, okay, but this, blah, blah. And so you need these combinations of characteristics and people in a team for like my wife, God bless her. She's my number one discerner.
Yeah.
She does not come up with solutions. She doesn't come up with like creative, again, solutions, but she can punch holes in things like I would never see. And it's like frustrating, but I'm like, okay, it has to pass her.
Yeah.
Like if it passes her and she can't come up with like a viable thing, then I'm on to something.
Totally.
And so for you saying like, I see a lot of problems, there's a place in the world for that person. We need those people to see the problems that exist. Now they may not be the same person that's going to solve them, but like finding and articulating a clear problem is so damn valuable, because I think most people have worked for organizations that have been attempting to solve a problem that didn't exist. Right. Or they're solving the wrong problem.
Yeah.
They're like, I can solve things. I'm going to solve things. It's like, yeah, but you went the wrong direction.
Yeah.
You should have solved this thing over here. So like, that's great though.
Yeah. Well, thank you. That's a boost of confidence of maybe I belong here a little bit. And also I would just say, I think it's, what's interesting to hear from the freshman class of legislators, which is a really diverse, interesting class. And, I'm honored to be there with them, is their motivation for running. Like it's such different reasons, but several of them, emphasize that they saw a problem. Like they saw a problem, and instead of just complaining about the problem, wanted to be part of that solution or wanted to do something about it. So
what was your thing?
My thing is really, it's a lot of things, but I would say my number one thing was probably the state of mental health care in Idaho. So, real talk, I have a child who has some serious and complex mental health, conditions, who, allows me to share that story whenever. And, when they were 12 years old, they first attempted suicide and were almost successful. They were on life support for 3 days. And, our world flipped upside down and we got thrown into this really messy and complex system of, hospitals and medications and providers and wait lists and, just stuff that you wouldn't wish on any family. And I consider, my family to be very strong, and we're pretty educated, and we can find answers to stuff. And like, I can't even count how many times we could not find answers to things, and it's so complex. So that was really my motivating factor, I would say. I also had the privilege last year of subbing, first on the Senate side and then on the House side. So I got to experience it for a little bit, and it was totally different than what I thought. At the time, I was in this mediation class in law school, and my classmates were like, oh, you're going to the place where nobody agrees on anything, right? And that was kind of my perception of it too. But I went and I took this little tally for them of every vote I made. And, you vote for a lot of different reasons. But by the time I came back after the 3 days, I had voted like 14 times, and 12 of them had been unanimous. And I think that people don't see that, like how much we actually agree on in that building is actually inspiring, right? And most people go there. Well, I would say everybody goes there with the intention of collaborating and working together. And we disagree on some, important things, but we also agree on a lot. And so it felt much better than I thought it would to be in that building.
Wow, there's a lot there. I'm sorry to hear about that family thing.
Thank you.
Yeah, I agree with you. People love highlighting differences.
Sure.
They do not like to show things working.
Yeah.
Like that's boring. It's like your friend says that like there's this big problem, or like or like somebody's like, I have a problem with my spouse, and you're like, they go home and tell them. It's like, what happened? It's like, oh, they just listened and we resolved it. It's like, that's not good. I want to hear plates broke. I want to hear that like somebody went to the Marriott, like you want that drama, and we've just become addicted to this drama. But point in case, you were walking in when Ron Nate was walking out, president of IFF, right?
He looked great. His suit was like super.
This is what I said.
Yeah.
This is what I said. I was like, your suit, and his tie was like this purple thing. I was like, what are you wearing?
I loved it.
And he said he got it in clearance. I was like, I think you're just saying that to like make yourself seem frugal. I bet you spent a lot of money on that suit. He looked great.
Yeah.
He looked great. But again, I had Lauren Necache in here yesterday. She was bagging on the grocery tax. And here comes Ron Nate bagging on the grocery tax. And these two people, as you know, could not be further ends of the spectrum.
Yeah.
And it's like, God bless it.
Yeah.
Here you come together for this very basic thing.
Yeah.
And like, I think Lauren also wants good education. I think Ron wants good education. I think they have different ways of going about that education. But it's like, okay, wait, so we all agree that education is important.
Yeah.
Ron, you're not saying let's uneducate.
Right.
Right? Like, you're for education. You're just for a slightly different system. Like, okay, so wait, we actually agree. We want good education.
Absolutely.
And this
happens all the time. It really does. Like, we align on different stuff all of the time with different people in that building. So I very much just approached it like a job. It feels like a new job, and you're meeting new coworkers. And of course, you're going to be respectful and courteous to all of them, but you also want to learn from them, right? And you want to see, like, where do we have shared values? And I have not met a person yet in that building that I don't have a shared value with. Like, there's a lot to agree on.
God bless it, man. Can I ask you something?
Yeah.
We've been at we're at the end of week 3.
Yeah.
We're coming to the end. It's Thursday. Tomorrow's Friday. Thank God.
So I'm pretty much an expert.
Oh my God. This is the first. I've never been in politics,
Okay.
and I'm not even in politics now. I'm just an idiot with a microphone.
Yeah.
And first off, I don't know if I can make it another 9 weeks. This has been the craziest 3 weeks of my life. But like, are you optimistic for this?
Yeah.
I really like this seems crazy.
Yeah.
Like, this, I feel like for all the hoopla, like cool things are kind of happening.
Yeah. No, I feel really optimistic for this. I think, so many people focused on the Dems numbers and the fact that we lost numbers, this election. And, I won't lie, like, that's sad for me. It's sad for me because those were my friends and, colleagues, and I want them to be in the building with me. But it doesn't change the scope of work at all. Like, we still need to do these things, right? Like, we need to find tax relief for Idahoans. We need to find a way to fund public education for Idahoans, because that's in our Constitution. We need to do these things. The work is there. I think the people are there to work with. I would say the challenge, which I know you've talked a little bit about this too, is that the thing that's been the most surprising to me, I would say, is how much right now, like, we just had an election and we just got in this building, but people's minds are already on the primary 2 years from now. And how many times?
Wait, really?
Yes.
Oh, they're like, don't do that. You'll get primaried.
Yes. And this is both parties, right? I'm not throwing either party under the bus. That is the new threat of, like, if somebody doesn't like what you're doing, then they're threatening to primary you, right? Like, right now already. And it's like, I don't think people understand that when I say this is like a new job, it's like a new job, but with 50,000 bosses. That's how many people we have in our districts for the most part, right? There's no way that you can win with all of those people. That's the really unique position that we're in. So the added pressure of trying to think about a primary 2 years from now, I just don't think it produces good results in government in Idaho. So I don't like that part.
Yeah, that's lame.
Yeah.
Come on, man. Like, I heard the old adage, like, the number one job on the first day is to get reelected. And it's like, that's silly. Like, come on, they don't, but apparently they do think that way.
Yeah. Yeah. I don't think anybody sent me here to get reelected. I don't think that's why they did. So it's not my focus, but it is a focus that's talked about in that building. But it doesn't change that I'm optimistic, right? And I think ultimately people are still going to be held accountable by their voters for doing the best thing for their districts. And so I hope that that's what we can all focus on.
That's great. Yeah, I see it's almost like we just need to eliminate all parties.
Mm-hmm.
Like, be a party of one.
Yeah.
I'm a consumer of one, right? Like we're all individuals when we come down to like our consumer and our personal preferences.
Totally.
So it's kind of like, it doesn't matter. You're still going to have a collection of people that care deeply. Let's look at education.
Yeah.
You're going to have a collection of people that care about maintaining a robust public education system. You're going to have people that want to not dismantle it, but restructure it so it's more privatized, contractor base. Like you're going to have people that tend one way or another. So it's kind of like, look, more Dems, more Republicans, less Republicans, as long as we have people fighting for the right issues and fighting successfully. Like one of the problems that I find with this structure is that we don't have enough competition of ideas.
Yeah.
Right. Like we need more competition of ideas. We need and I try to, in some sense, provide a marketplace for ideas where it's like, let's hash it out. Let's have this conversation. Let's have people hear it. They can understand the best argument for this position or that position. And then they can decide individually. Cause like, I don't know what's right. And in fact, I know too much about all sides. Like there is no right answer. Like,
absolutely.
You never get out of this place alive.
Absolutely.
And that's, so it's like, yeah, look, I can see that you'd be sad that, your friends are gone and that makes perfect sense. But at the same time, it's like, let's just get the work done.
Yeah.
Right. Like, let's try to resolve the problems for Idaho. Like fixing the healthcare system is not a Republican or Democrat thing.
Absolutely.
Right. Like fixing reimbursement rates, like addressing budgets. That's not a Democrat or Republican thing. It's like, we need to fix these things, like trying to preserve the wool growers association or wool growers, industry is not a partisan thing.
Absolutely.
We need the like pragmatic legislators.
Yeah. I have a friend on the other side of the aisle. I mean, I have many friends, many Republican friends, but one of them asked me, he said, what do you think are the main differences between our caucuses? And I was like, well, obviously we're funnier, but if you want like that, no, I'm just kidding. But if you want,
I don't know. I have a blast with Ron.
Yeah. Okay. Well, we're not counting him. Okay. Him excluded. But I said, I don't know the main differences. I don't caucus with you all, but I said, I'm curious. Are you ever told to vote your district? And they were just like, I don't even know what that means. And I was like, well, this is like a common thing that for Dems that we will say, right, is we don't have to vote the same, right? We're not going to tell people how to vote, but you should vote your district. And that means that you have to know your district well enough to know how they want you to vote on a subject. And there's no reason that just because I'm a Democrat district and somebody else is a Democrat district that we're going to have the same answer, right? Like Idaho's very diverse. And it didn't sound like that was something that they had heard before or like a message that they had heard. But I wish that we did hear more of that, of like vote your district and not your party, right?
I got one for you.
Yeah.
We may have solved this. Okay. Tell every Democrat to switch affiliation and run as a Republican. Leave no Democrats, and then everybody will be on the Republican ticket, and we will eliminate the primary.
Yeah.
And then there will be notice, and then everybody will have to vote for their district.
Yeah.
And that's it.
Yeah.
That's a genius idea.
Let's do it.
Come on. Can you just give me why not do that?
I think you're officially a politician now.
Oh my God. God bless you. Listen, thank you for coming in today. We hit a bunch of different things. Yeah. I know it's just week 3, so I really appreciate, your perspective. Let's connect again, like in a month or in mid-March, and like, let's kind of recap, like, okay, this was the experience of a freshman representative in the Idaho legislature. Cause man, I'll have a lot to say. You'll have a lot to say.
Absolutely.
This is great. Do you have anything else to say here at the end?
Just thank you. I love what you're doing.
Oh, thank you. I really appreciate you coming in. Thank you for helping me get the word out, and we'll do it again.
Thank you.